Thank you very much.
Thank you. I want to thank all of our panelists, Ms. McCoy, Mr. Flores, Mr. Rogers, Mr. Winfield, for your testimony and engagement today. We're going to move on to our next panel. Thank you very much. I want to invite up the members of the next panel on client services. We have Catherine Blakemore, Executive Director, Disability Rights California; Carol McKinney, Executive Director, Harmony Home Associated and Co-Chair, Governmental Affairs, California Supported Living Network; Boyd Bradshaw, President, Res Coalition; and Sue North, Government Affairs Director, California Disability Services Association. Welcome. Thank you all for being here. Ms. Blakemore, whenever you're ready, please proceed.
There.
Yes.
Thank you, Chair Bonta and members of the committee. It's really a pleasure to be here and talk to you from a client perspective about what the impacts are and to give you our suggestions of how we move forward. And I really appreciate the way in which many of you have framed the issues that are before us today. We are at a place in which we don't have the luxury of not doing something. It is time to take action because the system as we know it is crumbling for the clients that we serve. I'm Catherine Blakemore. I'm the Executive Director of Disability Rights California. We're a federally mandated agency that serves individuals with disabilities, and we also provide clients' rights advocacy assistance to the clients of California's regional center system, last year serving over 10,000 individuals with the difficulties they had in accessing services from a whole array of service agencies. I want to talk about two factors that have yet to be mentioned that are causing problems in the system and impacts on clients. And those have both human costs, both of them, and they also have financial costs that I think are incumbent upon us to look at. The first is that California's developmental centers, which are the state-run institutions that serve individuals, the legislature took action to close Sonoma and require the development of a plan. Since that time, there have been decertification notices at both Fairview and at the civil side of Porterville. What that means is that we will no longer get federal financial assistance if a facility is decertified. That's already happened at Sonoma, as many of you know, and that will happen at other facilities if we don't take steps to address that, creating an even bigger hole in an already fragile budget for this particular system. So there's really two pressures that we're facing. We need to move people, and we know we can move people into the community that live in developmental centers. We need to do it right. And to do it right, we need the resources to develop the kinds of living arrangements that will allow people to be successful in those community homes. And we also have the fiscal pressure of, if we don't do this under the timelines allowed by the federal government, we will create the lack of federal financial assistance, Medicaid funding, and we will therefore have a bigger hole in the budget. So a piece of what has to be solved is ensuring people can move to safe living arrangements that meet their needs. That means we need the capacity in the community to do that, and we need to do it quick enough so that we do not lose additional federal dollars, which is simply going to cause additional pressures on the system. The second factor that we have yet to discuss is new federal requirements about how this system must operate. So to continue to be eligible for the federal Medicaid match, CMS has issued new guidelines and requires the state to come up with a transition plan for how we're going to serve people that meet those standards. If we don't meet those standards, then we will lose federal Medicaid funding for a number of licensed residential facilities and an even greater number of day services that people receive. That transition must be completed by March 2019. But it is a long process by which we need to both give people transition planning money so that they can successfully change their programs, and ultimately rate increases that will allow them to successfully operate those new models of services that will achieve for individuals better outcomes because it will foster their participation in community living arrangements. So 2 additional factors on top of the things that you've already heard of today. I also want to take just a moment to talk about some recommendations that we have. And those recommendations are based on the reality of we both need additional new sources of revenue, and we have to prevent the loss of federal revenues that this system is significantly funded with. So DRC, my organization, of course, supports the managed care organization tax, although it does seem like progress in moving towards passing that is sort of at a very snail's pace. So I want to suggest to you some other ways from our perspective that we can increase revenues and more immediately address the looming crisis for this particular system. And those are, first, increase the federal match for individuals moving from institutions to the community through the Federal Money Follows the Person program, which allows up to a 75% match or so as compared to the 50% match. Ensure that housing development costs, you've heard a lot about the need to develop housing for individuals moving from institutions to the community, are included in the Speaker's Affordable Housing Initiative. 3, ensure that the data match between the Department of Health Care Services and DDS was done to identify private insurance that has primary responsibility for paying for some services. At one time, when this was first put in statute, it was identified as $10 million in potential new revenue. Consider an alternative provider tax on personal care services that has the potential to generate funding for both IHSS and the regional center system. So a different version of a provider fee and MCO tax. Equally important is ensuring that we do not lose the federal dollars that provide currently the 50% match for the DD system. To that end, we recommend limiting placements in what are called locked-skilled nursing facilities, better known as Institutes for Mental Disease or IMDs. Those facilities do not draw down any federal dollars because of a federal exclusion. Instead, we should quickly develop alternative community placements that will be eligible for a federal match. Ensure that appropriate community placements are promptly identified or developed for individuals in the decertified units that I previously talked about at the state developmental centers. And develop a transition plan with the resources that will allow residential and day programs to meet the new federal standards, because if they don't meet those standards, we once again will have a hole in the service areas. In addition to that, we also recommend that we look at the models that we need to move people successfully into the community, supported living, enhanced behavioral homes, and ensure that we have adequate capacity and that the rates that we're providing for those individuals are robust enough so that individuals can move and we can develop those. That particularly means in the short term looking at the rate cap on median rates, which limits the development of those types of facilities in urban areas. Set a deadline for the Health and Human Services Agency Task Force to develop a comprehensive rate proposal. We have been meeting for some time. I think we're making progress, but all good things must come to an end, and it's time for us to look long term and say, what is the comprehensive fix? Fourth, allow rate adjustments to meet local minimum wage adjustments. So you did something good last year, which was to adjust for the state minimum wage. But as we know, particularly for those of us that are from more urban areas, many local jurisdictions are passing local minimum wage ordinances. And when those pass, there has to be a mechanism by which providers, which are obligated to pay those new minimum wage rates, can get an enhanced rate adjustment to compensate for that increased local cost. And that was not a piece of what you passed last year. You were simply dealing with the state minimum wage adjustments. Finally, ensure that regional center caseloads meet federal standards so that we continue to draw down the appropriate federal dollars. Ensure that regional centers and clients' rights advocates have the resources to ensure that individuals can move from developmental centers into quality community living arrangements. We look forward to working with you. I appreciate the framing of your issue, and also want to acknowledge the work that many of you did in the last budget session to attempt to address the problem. But it is now time to come up with a plan that can be passed and signed into law to address the crisis in the developmental disability system. Thank you so much.
Thank you, Ms. Blakemore. Ms. McKinney?
Good afternoon. Thank you for the opportunity to address you today. My name is Carol McKinney, and I'm the Executive Director of Harmony Home Associated. We provide independent living and supported living services to about 275 people in Contra Costa County. I'm also the co-chair of governmental affairs for the California Supported Living Network. I co-founded Harmony Home in 1982, so I've been in this system a long time, and there's no doubt in my mind that this is the worst I've ever seen it. The years of cuts and rate freezes have taken its toll on this community, and it has impacted everybody, this decade of neglect. In the past, we had little difficulty finding and retaining staff. We were able to offer a competitive wage and benefit package. People love to work in this field, and now they can't afford to. And we can't attract a workforce with the wages we pay. Providers are struggling to find staff, and positions go unfilled for months. So our infrastructures start to break down because the supervisors and directors who used to provide supervision and quality assurance are now out providing coverage. Our direct care staff become overworked as they try to help us with this problem, and then there's nobody left to relieve them so they can go to a CPR recertification or extra trainings or take a vacation. Some staff ask for extra hours just to make ends meet. It's not uncommon to find somebody who works 7 to 10 hours a day, 5 days a week, does some overnight shifts, and works a weekend or two a month just to pay their bills. And what does this lead to? Burnout and turnover. Some providers report 50 to 60% turnover rates. And what does that do? Well, any business journal will tell you that turnover costs employers money, so now our costs go up. Some providers report that they have had wage freezes in place for over 5 years. It was mentioned earlier what inflation does to frozen wages. Some can't afford to pay the federal rate for mileage. It's about 57 cents a mile. Some providers report they pay 30 cents. That's 27 cents a mile out of the employee's pocket. Every year the cost of our benefits go up, so we look for something less expensive, which means the level of benefit goes down. Or we ask the employee to contribute more. Their wages stay the same, but their contribution increases, not to mention their rent, utilities, and groceries. So as luck would have it, last night some colleagues of mine and I were out to dinner, and the wait staff overheard us, and she told us that she used to work in the field at an agency here in Sacramento. Her name is Nicole, and she worked with a woman by the name of Nikki, and she used to program Nikki's communication board so she could come here and testify at hearings. So we asked her why she wasn't in the field. So I wrote down on the napkin last night the things that she said. So Nicole said, "Because I couldn't make ends meet. I was investing my entire life to this, and I can't even pay my bills. They make it hard to do what you want to do. In order to make a living, I had to give up my life, and I have a kid at home." That was from Nicole last night. So how does this all impact the person served? The Lanterman Act. I think somebody has a copy of it. Individualized services and supports, making choices based on one's needs and desires. It's beautiful. Well, that starts to break down. When a provider can't find someone to cover a shift, we're forced to do triage. Who's at risk? Who needs it the most? Who isn't going to get the support they need or want? We start scheduling shifts around when we have staff instead of when the person wants or needs the support. Debbie is not at risk at her apartment, but she can't go out into the community on her own. She wouldn't be safe. So a staff person comes in 2 or 3 nights a week so they can take her out. She can be part of her community. Well, Debbie's staff now has to go over and support somebody who is at risk. So Debbie can't go to the park and listen to music under the stars on Thursday night. She has to stay home. We have some people who need help getting into bed. When we have unfilled positions, we have to tweak the schedules. So the staff person says, sure, I can go in and I can help Joe get into bed, but I have to go to Sue's at 9:30. So that means I can only get to Joe's at 8. Joe's a 45-year-old man going to bed at 8 o'clock because that's the only time somebody can go in and help him. It's not even dark. Can you imagine? Joe can hear the kids outside his bedroom window playing. And this isn't remedied in a day. It takes time to find somebody, and once we do, there's the background check and the training. It takes a long time. Some of the people we support require very personal, intimate care. Personal hygiene, bowel care, toileting, bathing, dressing. Turnover takes a tremendous toll on these folks. When they interview people, because that's part of the process, they get to choose who they hire, they have to describe or listen to someone describe the very intimate details of their care to a stranger. And then we hope that they have more than just one person to interview, so they have a choice as to who comes in and helps them with that care. So they don't have to just take the one person who showed up. And then they have to go through the training with that stranger. Turnover for them is a nightmare. And then there are the outside pressures that push us in the wrong direction, unfunded mandates such as the local minimum wage increases that require a health and safety waiver to be funded. Some providers are still waiting 6 months later to get that request approved and funded. Many providers have been waiting over 6 months. I'm sorry, just said that. The state increases to the minimum wage that didn't fund the requirement to pay salaried exempt employees twice the minimum wage. The impending changes to the FLSA overtime requirement that is targeted to be funded at 5.82%, but statistics show it's really going to cost more like 12 to 15%. These pressures contribute to the dismantling of our system. Sonoma Developmental Center will close, and many people are happy about that. Kathleen Miller, the parent of a son who lives at Sonoma, and also the president of the Parents Hospital Association for Sonoma, told me about a survey they conducted asking families where in the community they would like their loved ones to move. She said 64 of the respondents said that they would like them to go into supported living. And that's great. But a survey that the California Supported Living Network recently conducted revealed that about 50% of supported living providers are not accepting referrals for people with complex needs because we can't continue to do it under these conditions. Of the 50% who are accepting referrals, about 90% stated they would look at referrals cautiously and only accept those where the costs are fully funded. So at the end of the day, the provider looks around and realizes this isn't my dream anymore. I'm no longer able to do what I set out to do. So they close, leaving fewer options in the community, leaving families in turmoil, and case managers scrambling to find something. We're not strangers to difficult times. We're state-funded after all. We're used to the ebbs and flows the economy triggers. The difference this time around is there haven't been any flows for a very long time. We endured years of cuts and freezes with the expectation that when the economy improved, we would receive some relief that would help stabilize the community. Many of you voted for that. It didn't happen, leaving the community feeling hopeless and helpless. The Developmental Services Task Force is working on ways to rebuild and strengthen this community. And I'm a member of the task force, and I can tell you we're nowhere near the completion of our charge. The community needs help now. We are falling apart. Thank you for your time.